The human heart, a remarkable organ, is often described as the body's engine. It's about the size of your fist, yet it pumps around 5 liters of blood every minute, circulating oxygen and nutrients to every cell. This muscular powerhouse beats approximately 100,000 times a day, tirelessly working to keep us alive. Did you know it has its own electrical system? The sinoatrial node, often called the heart's natural pacemaker, sends out signals that regulate the heartbeat. The heart has 4 chambers, 2 atria and 2 ventricles, working in perfect harmony to ensure efficient blood flow. Interestingly, the heart can also be influenced by our emotions. Stress can increase heart rate, while feelings of love can actually create a sense of warmth and relaxation. It's not just a pump, it's a vital part of our emotional and physical well-being. Understanding the heart is key to appreciating the intricate design of our bodies. The human heart is a vital organ that plays a crucial role in maintaining life. Located in the thoracic cavity, the heart is a muscular, hollow, and cone-shaped structure that pumps blood throughout the body. With its intricate network of blood vessels, the heart supplies oxygen and nutrients to tissues and organs, while removing waste products. The heart pumps approximately 2,000 gallons of blood daily. The heart adjusts blood pressure to ensure proper blood flow. The heart ensures blood reaches all parts of the body. The heart delivers essential nutrients and oxygen to tissues and organs. The heart consists of 4 chambers. The right atrium receives deoxygenated blood from the body. The right ventricle pumps blood to the lungs for oxygenation. The left atrium receives oxygenated blood from the lungs, and the left ventricle pumps blood to the rest of the body. The heart's remarkable structure and function make it an extraordinary organ, essential for sustaining life. Living with a heart disorder can feel like navigating a maze. You might think of heart issues as just heart attacks or arrhythmias, but there's a whole spectrum of conditions that often go unnoticed. Take cardiomyopathy, for instance. It's when the heart muscle becomes enlarged, thickened, or stiff, making it harder for your heart to pump blood. Then there's congenital heart disease, where structural problems are present from birth. It's fascinating how some people live their entire lives without knowing they have it, only to discover it later in life. And let's not forget about valvular heart disease, where the heart's valves don't function properly, leading to complications like heart failure. Symptoms can be subtle: fatigue, shortness of breath, or even palpitations. It's crucial to listen to your body and seek help if something feels off. Awareness is key. Understanding these disorders can lead to early detection and better management. So, whether it's through regular checkups or simply staying informed, taking charge of your heart health is essential. Here are some other heart disorders. Arrhythmias, irregular heartbeats, which can be caused by various factors such as electrolyte imbalances, medications, or underlying heart conditions. Cardiomyopathy, a disease of the heart muscle, which can lead to heart failure, arrhythmias, and sudden death. Heart failure, a condition where the heart is unable to pump enough blood to meet the body's needs. Coronary artery disease, CAD, a condition where the coronary arteries become narrowed or blocked, leading to reduced blood flow to the heart. Hypertrophic Cardiomyopathy, HCM, a condition where the heart muscle becomes thickened, which can lead to obstruction of blood flow and arrhythmias. Dilated Cardiomyopathy, DCM, a condition where the heart muscle becomes weakened and the heart chambers become enlarged, Myocarditis, inflammation of the heart muscle, which can be caused by viral or bacterial infections. Pericarditis, inflammation of the pericardium, the sac surrounding the heart. Endocarditis, infection of the heart valves or inner lining of the heart. Atrial septal defect, ASD, a hole in the wall between the upper chambers of the heart. Ventricular septal defect, VSD, a hole in the wall between the lower chambers of the heart. Tetralogy of Fallot, TOF, a combination of 4 heart defects, including VSD, pulmonary stenosis, right ventricular hypertrophy, and an overriding aorta. Hypoplastic left heart syndrome, HLHS, a condition where the left side of the heart is underdeveloped. Cardiac arrest, sudden loss of heart function, which can be caused by various factors such as heart disease, electrical disturbances, or trauma. Long QT syndrome, LQTS, a condition where the heart's electrical system is abnormal, leading to irregular heartbeats. Brugada syndrome, a condition where the heart's electrical system is abnormal, leading to irregular heartbeats. Wolff-Parkinson-White, WPW, syndrome, a condition where there is an extra electrical pathway in the heart, leading to irregular heartbeats. Ebstein's anomaly, a congenital heart defect where the tricuspid valve is abnormal and the right ventricle is small. Tricuspid atresia, a congenital heart defect where the tricuspid valve is missing. Pulmonary atresia, a congenital heart defect where the pulmonary valve is missing or blocked. These are just some of the many heart disorders that exist. Each disorder has its own unique symptoms, diagnosis, and treatment options. The human heart is a remarkable organ about the size of a fist, tirelessly pumping blood throughout our bodies. It has 4 chambers, the right and left atria, and the right and left ventricles. The right atrium receives deoxygenated blood from the body, while the left atrium collects oxygen-rich blood from the lungs. The ventricles then do the heavy lifting. The right ventricle pumps blood to the lungs for oxygen, and the left ventricle sends it out to the rest of the body. Valves between these chambers, like the tricuspid and mitral valves, ensure blood flows in one direction, preventing any backflow. The heart's electrical system, led by the sinoatrial node, keeps the rhythm steady, allowing it to beat around 100,000 times a day. It's not just a pump. It's a vital, dynamic hub that supports every single cell in our body, showcasing the incredible complexity of human anatomy. The external structure includes the pericardium, a double-layered sac surrounding the heart, providing protection and lubrication, and the epicardium, the outermost layer of the heart, composed of connective tissue and fat. The internal structure consists of the myocardium, the thick middle layer of the heart, made up of cardiac muscle cells responsible for contraction, and the endocardium, the innermost layer of the heart, lining the chambers and valves. The chambers include the right atrium, the upper right chamber receiving deoxygenated blood from the body, the right ventricle, the lower right chamber pumping blood to the lungs for oxygenation, the left atrium, the upper left chamber receiving oxygenated blood from the lungs, and the left ventricle, the lower left chamber pumping blood to the rest of the body. The valves include the tricuspid valve between the right atrium and right ventricle, ensuring blood flows from the right atrium to the right ventricle. The pulmonary valve between the right ventricle and pulmonary artery, regulating blood flow to the lungs. The mitral valve between the left atrium and left ventricle, ensuring blood flows from the left atrium to the left ventricle. And the aortic valve between the left ventricle and aorta, regulating blood flow to the rest of the body. The blood vessels include the aorta, the largest artery arising from the left ventricle, carrying oxygenated blood to the body. The pulmonary arteries, carrying deoxygenated blood from the right ventricle to the lungs. The pulmonary veins, carrying oxygenated blood from the lungs to the left atrium. And the coronary arteries, branching off the aorta, supplying oxygenated blood to the heart muscle itself. This complex structure works together to pump blood efficiently throughout the body. The human heart is an extraordinary organ, a muscular powerhouse that pumps life through our veins. Every day, it beats around 100,000 times, circulating about 5 liters of blood per minute. This relentless rhythm delivers oxygen and nutrients to every cell in our body, fueling our every move. But the heart does more than just pump blood. It also plays a crucial role in regulating blood pressure and maintaining our body's temperature. Its electrical system ensures that it beats in a coordinated manner, allowing for efficient blood flow. Interestingly, the heart has its own intrinsic rhythm, capable of beating independently of the brain. It's a remarkable example of nature's design, reminding us that our emotions can even influence our heart rate. So whether it's racing during excitement or slowing during relaxation, the heart truly reflects our inner state. It's not just an organ. It's a vital part of who we are. Pumping blood. The heart receives deoxygenated blood from the body through the superior and inferior vena cava. The heart pumps blood to the lungs to pick up oxygen and release carbon dioxide. The heart pumps oxygenated blood from the lungs to the rest of the body. Regulating blood pressure. The heart adjusts its pumping rate and force to maintain healthy blood pressure. The heart regulates the amount of blood pumped per minute to meet the body's needs. Maintaining circulation. The heart ensures blood reaches all parts of the body, including organs, tissues, and cells. The heart adjusts blood flow to different parts of the body based on needs and activity. Supplying oxygen and nutrients. The heart delivers oxygen to tissues and organs. The heart supplies nutrients such as glucose and amino acids to tissues and organs. The heart helps remove waste products such as carbon dioxide and lactic acid. Other functions. The heart helps regulate electrolyte levels such as potassium and sodium. The heart helps maintain the body's acid-base balance. The heart responds to stress by increasing pumping rate and force. Overall, the heart plays a vital role in maintaining the body's overall health and function. The human heart has 4 remarkable valves, each playing a crucial role in keeping our blood flowing smoothly. The tricuspid valve, located between the right atrium and ventricle, ensures that blood moves in the right direction, preventing backflow. Next, the pulmonary valve sends deoxygenated blood to the lungs for a fresh supply of oxygen. Then we have the mitral valve, which opens and closes to let oxygen-rich blood flow from the lungs into the left ventricle. Finally, the aortic valve distributes that oxygenated blood to the rest of the body. These valves work tirelessly, opening and closing about 100,000 times a day. When they function properly, we hardly notice them, but any malfunction can lead to serious health issues. It's fascinating how such small structures can have such a massive impact on our overall health and vitality. The tricuspid valve is located between the right atrium and right ventricle, ensuring blood flows from the right atrium to the right ventricle. The pulmonary valve is located between the right ventricle and pulmonary artery, regulating blood flow to the lungs. The mitral valve is located between the left atrium and left ventricle, ensuring blood flows from the left atrium to the left ventricle. The aortic valve is located between the left ventricle and aorta, regulating blood flow to the rest of the body. The leaflets are thin, flexible flaps that open and close to regulate blood flow. The annulus is a ring-like structure that supports the leaflets. The chordae tendineae are fibrous strings that attach the leaflets to the papillary muscles. The papillary muscles are small muscles that contract to close the leaflets. Valves prevent backflow, ensuring blood flows in one direction, preventing backflow into the previous chamber. They regulate blood flow, controlling the amount of blood flowing through the heart. They also help maintain blood pressure by controlling blood flow. Valve disorders include stenosis, which is the narrowing of the valve opening, restricting blood flow, regurgitation, which is the leaking of the valve, allowing blood to flow backward, and prolapse, which is the bulging of the valve leaflets, disrupting blood flow. Treatment options include valve repair, which is the surgical repair of the damaged valve, valve replacement, which is the replacement of the damaged valve with a prosthetic one, and minimally invasive procedures such as balloon valvuloplasty. The heart valve is a fascinating structure, acting like a gatekeeper for blood flow. Picture this. There are 4 main valves in the heart, 2 atrioventricular valves and 2 semilunar valves. The mitral and tricuspid valves control blood flow from the atria to the ventricles, ensuring that blood moves in one direction. Then, the aortic and pulmonary valves manage blood leaving the heart, preventing backflow. Each valve consists of flaps called cusps, which open and close with each heartbeat, creating a symphony of movement. The mitral valve, shaped like a bishop's mitre, has two cusps, while the tricuspid valve boasts three. The strength of these valves is crucial. They withstand the pressure of blood being pumped through the heart. When they function properly, they maintain efficient circulation, but if they malfunction, it can lead to serious health issues. Understanding the structure of heart valves not only highlights their importance, but also showcases the incredible design of our cardiovascular system. Here's a detailed overview of the function of each heart valve. The tricuspid valve allows blood flow from the right atrium to the right ventricle, prevents backflow from the right ventricle to the right atrium, and regulates blood flow between the right atrium and right ventricle. The pulmonary valve allows blood flow from the right ventricle to the pulmonary artery, prevents backflow from the pulmonary artery to the right ventricle, and regulates blood flow to the lungs for oxygenation. The mitral valve allows blood flow from the left atrium to the left ventricle, prevents backflow from the left ventricle to the left atrium, and regulates blood flow between the left atrium and left ventricle. The aortic valve allows blood flow from the left ventricle to the aorta, prevents backflow from the aorta to the left ventricle, and regulates blood flow to the rest of the body. Each valve plays a crucial role in maintaining efficient blood flow and preventing backflow, ensuring the heart functions properly. The human heart has 4 valves, each playing a crucial role in keeping blood flowing in the right direction. When these valves malfunction, it can lead to serious disorders. Take aortic stenosis, for example. It narrows the aortic valve, making it harder for the heart to pump blood. Imagine trying to push water through a tiny opening. It's exhausting. Then there's mitral regurgitation, where the valve leaks, causing blood to flow backward. This can lead to fatigue and shortness of breath, making even simple tasks feel monumental. Valvular heart disease can stem from various causes, including age, infections, or congenital defects. Treatment options range from medication to surgical interventions, like valve repair or replacement. It's fascinating how a small structure can have such a profound impact on our health. Understanding these disorders not only highlights the complexity of our bodies, but also emphasizes the importance of regular checkups. After all, a healthy heart is key to a vibrant life. Here are some common disorders of the human heart valves. Mitral regurgitation is the leaking of the mitral valve, allowing blood to flow backward into the left atrium, with symptoms like shortness of breath, fatigue, and palpitations. Aortic stenosis is the narrowing of the aortic valve, restricting blood flow from the left ventricle to the aorta, with symptoms including chest pain, shortness of breath, and fainting. Tricuspid regurgitation involves the leaking of the tricuspid valve, allowing blood to flow backward into the right atrium, leading to shortness of breath, fatigue, and swelling in the legs. Mitral stenosis is the narrowing of the mitral valve, restricting blood flow from the left atrium to the left ventricle, with symptoms like shortness of breath, fatigue, and palpitations. Aortic regurgitation is the leaking of the aortic valve, allowing blood to flow backward into the left ventricle, causing shortness of breath, fatigue, and palpitations. Causes of valvular heart disease include congenital defects, aging, infections like endocarditis, rheumatic fever, trauma, tumors, and connective tissue disorders. Symptoms can include shortness of breath, fatigue, chest pain, palpitations, and swelling in the legs, ankles, or feet. Diagnosis can involve a physical examination, echocardiogram, cardiac catheterization, or MRI or CT scan. Treatment options include medications like diuretics and beta blockers, valve repair or replacement surgery, balloon valvuloplasty, and transcatheter aortic valve replacement, TAVR. A heart stroke, or more commonly known as a heart attack, happens when blood flow to the heart is blocked. Imagine your heart as a pump that needs a steady supply of oxygen-rich blood to keep beating. When that supply is cut off, the heart muscle starts to die. Symptoms can vary. Some feel a crushing chest pain, while others might just experience shortness of breath or even nausea. It's crucial to recognize these signs early. Risk factors include high blood pressure, smoking, and a sedentary lifestyle. But here's the good news. Many heart attacks are preventable. Regular exercise, a balanced diet, and routine checkups can significantly reduce your risk. Remember, your heart is your lifeline. Take care of it, and it will take care of you. A heart stroke, also known as a heart attack or myocardial infarction, MI, occurs when the blood flow to the heart is blocked, causing damage to the heart muscle. Causes of heart stroke include blockage of coronary arteries, blood clots, and plaque buildup. Symptoms of heart stroke include chest pain or discomfort, shortness of breath, pain or discomfort in the arms, back, neck, jaw or stomach, cold sweats, lightheadedness or dizziness, and fatigue. Types of heart stroke include ST elevation myocardial infarction, STEMI, non-ST elevation myocardial infarction, NSTEMI, and unstable angina. Treatment of heart stroke may involve medications, angioplasty, coronary artery bypass grafting, CABG, and cardiopulmonary resuscitation, CPR. It's essential to seek medical attention immediately if you or someone you know is experiencing symptoms of a heart stroke.